Now this is an ultrasound study of a 28 years old female presenting with the pain in the pelvic region. This is the urinary bladder in transverse section, and this is the urinary bladder in longitudinal section. I am scanning the pelvic region, and here in longitudinal section you will see a few normal as well as pathological structures. Now this is the uterus, this area. This is the let me align the uterus with the vagina. She is an unmarried female. Now this is the longitudinal section, and in longitudinal section we see that the uterus measures 5.5 centimeters in length and only 2 centimeter in anterior posterior. Diameter is relatively small in size. This is the urinary bladder in longitudinal section. To prove it, you ask the patient to micturate and this will disappear. This is a cystic area aside the urinary bladder in the pelvic region, extending into the right adnexa. And another now this is when I move the probe towards the right side in the region of the right adnexa, I do see the right ovary with follicular activity. You can see that this is the right kidney. You can see the follicles in different stages of development. This is the right ovary, this is the follicle, this is another follicle, and this is the right ovary. Now from here we can see that there is a cystic area relating to the, here you can see it relates to the right ovary and then extends in upwards and into the region of the right lower abdominal quadrant. You can see laid out material within the cystic area. This is the cyst, right adnexal cyst, measuring almost 9.5 into 5.6 centimeters, but when surgical intervention will be done, it will be more than 10 into 6 centimeters. And you see that there are multiple layered out ecogenic areas, strand form in the form of a strand with multiple, and the anterior half of this cyst is seen also having ecogenic areas which are fixed, they do not move, and if we wish to get the approximate volume of this cystic area, then the volume of this cystic area is, it is almost an ecophil area, cystic area. These are the ecogenic areas. These are all mild, low-level ecogenic areas. Few cystic areas are seen. In this, you can see central irregularly outlined cystic area. We did not see any calcification or solid element in the cyst. And this is the longitudinal section of the cyst, and the cyst measures, again you can see the measurements, 9.3, 5.9, 6.3 centimeter, and its approximate volume is 183, which will be more than 200 ml when operated upon. So this is a the three differentials come in my mind by seeing this. This is in fact either a hemorrhagic cyst with hemorrhagic right ovarian cyst, or number 2, it is a mucinous cystadenoma. 3, it can be a mucinous cystadenoma. Our possibility of its being infective in nature and cannot be ruled out, but most probably the initial 3 that I have narrated to you are the differential diagnosis of this case. Now the uterus is relatively small size, because you see that this cystic area, it is extending anterior to the uterus at its frontal region. Here you can see this is the cystic area, and this is the uterus. बेटा तारीख ठीक आनी, तारीख ठीक होंगी, और कितने दिन रहती है?
3 महीने का, बिल्कुल 2 दिन है.
This is a longitudinal section of the pelvis. कितने बेटा?
2 दिन.
बस. She does have a history of oligomenorrhea. I am not provided with any clinical or gynecological exam or any other lab profile is available to me. So I will say that this is a case of relatively small sized uterus with a cystic area in the region of the right adnexa extending anterior to the fundus of this is the fundus of the uterus. So extending anterior to the fundus of the uterus, full of echogenic areas layered out within this cystic area with the possible differentials that I have narrated. And in this case the prognosis may be better, as we can see endometrial lining in this case. This is the vagina, this line, cervix, endometrial canal, and this is the myometrium. So in fact a hypoplastic uterus will be the diagnosis. Thank you very much.